Are you wondering how to support your diastasis recti during your pregnancy? You're already feeling the separation. Maybe it's painful. Maybe you're getting some cramping or aching in your belly. Maybe you feel like you absolutely can't even work out. You've probably tried the binders. Maybe you've ordered a couple on Amazon and you're just not finding what works for you. Now, binders can be okay, but we want our muscles to support our abdominal walls. And so we want to not, when we bind or if we wear a support belt or if we wear any wraps during pregnancy, yes, they can feel supportive, but they also prevent our muscles from working. So I really don't suggest belting, using any kind of support wear unless you're having excruciating pain that limits your ability to move and do your exercises. So we want to make sure that you're using your actual muscles to support your core while you're pregnant. Now, this can be a challenge if you feel like you have a diastasis recti or if you feel like you're getting some separation. So I'm going to go through some tape techniques here of how to tape your pregnant belly to make sure that you help reduce the force and the separation on the diastasis, preventing it from getting worse. So you can use tape as a supportive way to support the belly. I want to make sure that you know a few things. Tape can be really good and can help you utilize your muscles. However, during pregnancy, the skin on the belly can become very sensitive. And so you want to make sure that you don't wear this for longer than a day or two. Outside of pregnancy, wearing it for up to 4 days, totally fine. During pregnancy, we want to make sure there's no skin reaction or skin irritation long term. So really only wearing the tape for 1 to 2 days. And if you start to feel any itching or irritation within the first 10 to 15 minutes or any time throughout your wear, you want to make sure you remove this tape right away. So let's get into these tape techniques because these can be absolutely beneficial and helpful to help support your pregnant body, and they're just stuff that you can do at home. So here we go. So here I am going to tape the belly. So she has some degree of diastasis here. Granted, she's not showing a lot here. So you can do this prenatally, you can do this postpartum. During pregnancy, absolutely safe. Just make sure your skin can tolerate the tape. So let's get started. All right, our very first technique is gonna be our most cumbersome. So this is gonna be extremely supportive. So if you only want a little bit of tape and you're not looking for a ton of support, then we're gonna show you a technique later on. This is gonna be the most supportive technique that you'll have, and you can use this and you can try all the different techniques that I'm gonna teach you today. So here we go. The first tape technique for the belly is we're gonna rip part of the tape. These are pre-cut strips like this. I'm currently using KT tape. You can use Kinesiotape, you can use rock tape. You can find a tape that maybe feels better on your pregnant belly skin that is thin and stretched out. So we're gonna take the bottom of the tape. We're gonna start all the way down at the pubic bone. Now, if you have hair in that mons pubis area, you probably want to go above the hair or shave before you do this, but I'm putting the tape here. There's no stretch on the tape when I lay it down. Then I am lifting up towards her head, and I am lifting and pulling. So if this is 100%, I am lifting and pulling about 25%. Then I just simply lay down the tape. This one's a little long. I should have probably cut it, and you can cut it to fit your belly. Now, as the belly grows big, you might need actually 2 pieces of tape in order to make it all the way up the belly. And that's totally fine and normal. You just want to support what you have going on. And so again, we're doing this to support a diastasis recti and preventing that diastasis from getting worse. I'm going to repeat this on the other side of her belly, on the rectus abdominal muscle itself. Here we go. So again, I'm down at pubic bone. No stretch on the tape whatsoever when I lay it down. Then I'm pulling up, lifting up about that 25% and laying it down flat. At the end of the tape, there is absolutely no pull whatsoever. All right, so this is the initial part of it. Then what I've done is I've gone and pre-cut some strips. And when I pre-cut the strips, I'm cutting a small, you can cut like one pre-cut strip in half. It's gonna be based on how big your belly is. Again, I'm working on a small abdominal wall right now, so there's not this huge fetus growing in the belly, so we aren't showing yet. So we're just doing this very early stages. She might need a full piece of tape to do this and might not need to cut these strips. So here we go. You're gonna see me break this in half, and all I'm doing is creating and reinforcing the linea alba between the two six-pack ab muscles. So then I'm laying some of it on the skin and I'm pulling over. And I'm just gonna go up the abdominal wall as I do this tape job. So ideally, you can use all the same colors, whatever is important to you. I'm just using scrap tape that I had here at my office. And simply just sewing up the front of the belly. And again, this is something you can do postpartum. Absolutely do it during pregnancy, especially if you're having pain in these areas. There we go. And I would take it all the way up. So the reality is that you can get separation below the belly button, at the belly button, or above the belly button. You know, you can check out our other videos. We have some great diastasis recti content explaining all about the separations that can occur in the abdominal wall and how to prevent them. So ideally, you're bringing the tape all the way up, and you want to go even to the rib cage here, because especially during pregnancy, we're getting that rib flare and opening. So you're gonna get pull in the linea alba and you could have a diastasis up here. So we're supporting it up here by taking the tape all the way up. So this is the first tape technique that we're gonna use, and it can be extremely supportive, and this is the maximum support of the tape. Now we're gonna go into a couple more techniques that will teach you how to support the belly with less tape, a little less aggressive, but a little less support. Okay, the next technique we're gonna use for taping and helping support the abdominal wall is gonna be an X cross position, and it's gonna be a little less support. And then as we finish this tape technique, there's one additional piece of tape that you can add to also provide a little bit of bladder support for the belly. And so here we go, we're gonna go into another tape technique for the diastasis. And so if you know where your separation is. So you've gone through our video and you've identified exactly where your separation is occurring. Please check that video out because you'll want to know where it's happening before you do this tape technique. So once you determine, okay, it's happening at the belly button or it's happening above the belly button, that's where you want the X to cross. That's what we're gonna do here. So Victoria here, I can feel her little separation right at her navel. It's not clinically significant, but it's something that as her baby grows, I want to prevent. So as she's doing more aggressive exercises, she might use this type of tape to help support and make sure that the diastasis doesn't get worse. So again, I'm just peeling off a bottom part of it. I'm gonna take my tape to her hip bone here, and I am gonna place it right down at the hip bone, again, with no pull or stretch. Then I'm gonna scoop baby up and scoop belly up just a little bit, and then bring this right across the navel where her separation is. Now, if her separation was down low, we'd be going at a lower angle. And now if it was up high, we'd be going at a higher angle. Because it's at the belly button, we're going at this angle here, and I'm attaching it all the way to her rib. And again, about a 25% stretch. Then we're gonna go on this side here, from here to here, crossing right at the belly button. I've laid it down, no stretch, and now I'm just lifting belly up, crossing there, and I'm gonna anchor this down at her ribs. So as her ribs start to flare throughout her pregnancy, this can also be nice to help keep the ribs a little down and compressed, but it's also supporting the belly here. So now when she is doing her training and exercises, she's gonna be really safe and prevent this area from splitting any further than it already is. So this can be a great tape technique. So this is option number 2, a little bit less support, but still very, very effective and less cumbersome. So you don't have to do as much cutting and taping and can feel a little bit easier on the skin. So this is option number 2. Here is the finished product of the tape technique number 2 with the smiley face. Now, option number 2, you can add a third piece. And this third piece is absolutely awesome if you're feeling any pelvic pressure, any pubic bone pain, or any round ligament pain. This is gonna help prevent that. So I will take one piece of tape here. I will rip the tape, the paper on the back, right in the middle. Then what I do is I come down to her pubic bone, and I feel right above where bladder is, and bladder is being smushed down under the uterus, which is growing the baby. I stick the tape there with no stretch whatsoever. I place my hand on the tape, and then I pull the tape piece up in a smiley face position. So it's like a scoop and a swoop, a scoop and a swoop. And then I'm pushing bladder up, pushing uterus up a little bit, and again, doing the same thing on this side, making sure the last inch of the tape, there's no pull whatsoever. There's no pull on the tape because that will stress the skin out. And so the last inch never has any pull on any of these places. So then that is what it looks like to have this completely done, taping for the diastasis. So I hope you found this helpful. You have 3 options here. They're all great options. One's gonna give you a little bit more support, one a little less, and one is gonna be a little bit of an assist for bladder, round ligament, and any pubic bone pain that you're having. I hope you found this helpful. Like and subscribe to our videos. We put out a ton of content related to having healthy, safe, pain-free pregnancies, and we do a ton on preventing tearing during delivery and helping optimize your delivery so you're not pushing for hours. So definitely check out our content. We are here for you. Drop us a comment and we're happy to answer anything specifically for what you're dealing with. And I hope you find these tape techniques extremely valuable in supporting your diastasis during your pregnancy. I'm Dr. Allison Felt. Thanks for joining me today. See you next time.